So radial nerve is the thickest branch of brachial plexus. It's the thickest branch of brachial plexus, and root value of radial nerve is C5 to C8 segments and T1 segments of spinal cord. Now, course of radial nerve. Upper arm, it starts from the upper arm. After its origin, it courses along the posterior aspect of the upper arm, running alongside the humerus bone. It usually travels within the spiral groove of the humerus. So upper arm. Then, as it reaches the cubital fossa, it reaches the elbow region. The radial nerve typically divides into two main branches here: the deep branch and the superficial branch. Then, the deep branch continues deeper into the forearm, running between the two bones of forearm, radius and ulna. It supplies the extensor muscles of the forearm. Now, the superficial branch takes a more superficial path and continues down towards the back of the hand, providing sensory innervation to the skin on the back of the hand, including thumb, index finger, middle finger, and half of the ring finger. Now, this reaches the forearm. The deep branch of the radial nerve provides motor innervation to various. So, the deep branch of radial nerve provides motor innervation to various muscles responsible for extending the wrist and fingers. Now, wrist and hand. Superficial branch of radial nerve primarily carries sensory information from the back of the hand, while the deep branch controls the extensor muscles of wrist and fingers. So again, the upper arm, after its origin, it courses along the posterior aspect of upper arm, alongside the humerus bone. This is the posterior aspect, and it runs along the spinal groove of the humerus bone, and it usually travels within the spiral groove. Now, cubital fossa, as it reaches the cubital fossa, it divides into a deep branch and superficial branch. The deep branch continues deeper into the forearm, running between the two bones of the forearm, that is radius and ulna, and supplies the extensor muscles of the forearm. Superficial branch provides sensory innervation at the back of hand, including thumb, index finger, and middle finger. Now, the branches of radial nerve. So we have branches in axilla. There are two muscular branches and one cutaneous branch in the axilla. Two muscular for long head and medial head of triceps, and one cutaneous for posterior cutaneous nerve of arm. So two muscular for triceps, two heads of triceps, and one cutaneous for posterior cutaneous nerve of arm. Now the branches in spiral groove. There are branches in spiral groove. There are three muscular and two cutaneous branches. So three muscular branches are lateral head of triceps, medial head of triceps, and anconeus for these three muscles, and two cutaneous branches for posterior cutaneous nerve of forearm and lateral cutaneous nerve of arm. Now, branch in lateral aspect of arm. Lateral aspect of arm will supply brachialis, brachioradialis, and extensor carpi radialis longus. Brachialis, brachioradialis, and extensor carpi radialis longus. Now, branches in the cubital fossa, as mentioned earlier, are two superficial and deep branches. Superficial branches supply skin on dorsal of hand and proximal phalanges of lateral 2.5 fingers. So these are the proximal phalanges, and this is the lateral 2.5 fingers. So at this area is supplied by radial nerve. Now the clinical aspect, radial nerve injury. This can occur due to trauma, compression, or nerve entrapment. That is, nerve entrapment is compression at various points, and the symptoms are most important one is wrist drop. That is inability to extend wrist and fingers. So this is the position. And there is weakness in forearm and hand extension, and numbness and tingling in back of hand and forearm, and pain in arm, elbow, or hand. Now the course, drawing of the course of radial nerve. This is the course of radial nerve. So radial nerve coming from brachial plexus, and this is the posterior cutaneous nerve of arm, which is the cutaneous branch, and there are two muscular branches for triceps brachii muscle. Then this comes in the radial groove, and it again gives three muscular branches and two cutaneous branches. The three muscular branches for triceps brachii, medial head of triceps brachii, and anconeus, and two cutaneous for arm and forearm. Lateral cutaneous nerve of arm, posterior cutaneous nerve of forearm. Now, in the arm, it is at the lateral aspect of arm, it is giving branches for these three muscles: brachialis, brachioradialis, and extensor carpi radialis longus. Now, in the forearm, it divides into deep branch, superficial branch. Superficial branch provides sensory sensations. Deep branch supplies the extensor muscles of the forearm. It supplies extensor carpi radialis brevis, supinator, extensor digitorum, digiti minimi, carpi ulnaris, extensor pollicis brevis, extensor pollicis longus, and extensor indicis. And this is the cutaneous distribution of radial nerve. This is posterior cutaneous nerve of arm, lower lateral cutaneous nerve of forearm, posterior cutaneous nerve of forearm, and this is the superficial branch of radial nerve supplying the proximal 2.5 fingers. And this is how the wrist drop looks like. And radial nerve injury also leads to Saturday night palsy or crutch palsy. So sleeping in an armchair with a limb hanging at the side of chair leads to Saturday night palsy, and fractures of the shaft of humerus leads to weakness and loss of power and leads to the wrist drop. So now ulnar nerve. Ulnar nerve is named so as it runs along the medial or ulnar side of the upper limb, and root value of ulnar nerve is C8 and T1. The root value of radial nerve whereas was C5 to C8 and T1. Now ulnar nerve C8 and T1. The course of ulnar nerve in the upper arm, it runs down the upper arm passing through the axilla, armpit, and along the medial side of the humerus bone. Then elbow. At the elbow, it passes behind the medial epicondyle of humerus. Then forearm. After passing the elbow, the ulnar nerve continues down the forearm, running alongside the ulnar bone. At the wrist, it then passes through a tunnel-like structure known as Guyon's canal at the wrist, which is formed by pisiform and hamate bone. Then hand. It provides motor control to the muscles like those that control finger flexion and intrinsic hand movement. Then sensory distribution. The ulnar nerve also provides sensory innervation to the medial part of the hand, including little finger and part of ring finger. So repeating the course again, runs down the upper arm, passing through the axilla, along the medial side of humerus bone. Then at the elbow, it passes behind the medial epicondyle of humerus. In the forearm, it passing the elbow, ulnar nerve continues down the forearm alongside the ulnar bone. Then hand, it provides motor control to muscles like those that control finger flexion and intrinsic hand movement. In the wrist, it passes through the Guyon's canal. Then the sensory distribution. The ulnar nerve also provides sensory innervation to medial part of hand, including the little finger and part of the ring finger. So ulnar nerve injury causes a trauma, compression, and stretching. Symptoms are numbness and tingling, weakness in hand, and pain. It leads to cubital tunnel syndrome, paralysis of medial half of flexor digitorum profundus, paralysis of muscles of hypothenar eminence, paralysis of interossei and adductor pollicis, paralysis of third and fourth lumbricals. Now the course of ulnar nerve. This is the course of ulnar nerve arising from C8 and T1. Axilla, it is not having any branches. In the arm, it is going to the elbow joint. Then in the forearm, it is supplying flexor carpi ulnaris and flexor digitorum profundus, giving the palmar cutaneous branches, and to the wrist joint and dorsal cutaneous branch towards the hand. In the hand, it is supplying muscles of hypothenar eminence, adductor pollicis, third and fourth lumbricals, all palmar and dorsal interossei, palmaris brevis, and all these muscles. So median nerve. Origin of the median nerve. It originates from lateral and medial cords of the brachial plexus, primarily composed of nerve roots from C6 to T1. Course of median nerve. In the upper arm, median nerve runs down the upper arm along with brachial artery, passes through arm's anterior compartment. Then elbow. It continues its course through the forearm, passing through the cubital fossa at the elbow. Then forearm. Median nerve travels down the forearm, passing between the two heads of pronator teres muscle. It continues its journey into the hand through the carpal tunnel. Then wrist. At the wrist, the median nerve passes through the carpal tunnel, which is formed by carpal bones and the transverse carpal ligament. So begins at the upper arm, brachial plexus, the median and lateral cord. At the elbow, its course is it continues its course to the forearm, passing through the cubital fossa at the elbow. Then forearm travels down the forearm, passing between the two heads of pronator teres muscle, and the rest it runs in the carpal tunnel. Then compression of median nerve at this point can lead to condition called carpal tunnel syndrome. This is the important clinical feature of median nerve. Compression leads to carpal tunnel syndrome. So at the hand, it provides motor and sensory innervation to various muscles and areas of the hand. It innervates muscles contributing thumb movement and sensation on the palm side of the hand, including thumb, index finger, middle finger, and half of the ring finger. So in carpal tunnel syndrome, compression under flexor retinaculum occurs, which leads to paralysis of thenar muscles and ape-like or monkey-like hand appearance, loss of sensation in lateral 3.5 digits, including nail beds. Loss of sensation in lateral 3.5 digits, including nail bed, and median nerve is referred to as the eye of the hand. This leads to ape-like deformity, which is like this. Now the course of median nerve. This is the course of median nerve coming from medial root and lateral root of brachial plexus. Then running in the anterior compartment of forearm, supplying the flexor muscles, pronator quadratus, and running in the palm, and these cutaneous branches supplying lateral 3.5 digits and opponent's pollicis muscle. This is the eighth thumb deformity in carpal tunnel syndrome, and median nerve in carpal tunnel is compressed, leading to carpal tunnel syndrome, paralysis of thenar muscles, sensory loss, and Fallon's test is performed to check for carpal tunnel syndrome. This paralysis of thenar muscles leads to ape-like thumb. It's the flattened thenar eminence and lack of index and middle fingers, making fist. It's the sensory loss over here, paralysis of first and second lumbricals. This is the Fallon's test.